Silver Springs. Proud sponsor of Friday night Marion County High School football on WOCA, The Source.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 8 minutes before 11 o'clock. 8 minutes to talk about a pretty serious topic. This week is Halloween, and chances are there will be lots of goodies to eat, and chances are you'll get a bellyache. I don't think that has anything to do with what we're going to talk about. But it sounds like it does, doesn't it? Irritable bowel syndrome. Yeah. And maybe it does. Maybe eating junky candy and stuff is something we need to think about. Craig Strasnick is on the phone. He's the Chief Operating Office of Commonwealth Laboratories. He's on the air to talk to us about something called the IBSChek. It's a new laboratory-developed blood test designed to help physicians quickly and reliably diagnose irritable bowel syndrome. My first question is, what is it? Actually, my first question is, where is Craig? Good morning, Craig. How are you?
Hey, I'm good, Larry. How are you?
Good. Where are you calling from?
I am actually calling from Barcelona, Spain at the moment. We are overseas for the European United Gastroenterology Week.
Oh, my goodness.
Oh, cool.
So do you have to say irritable bowel syndrome in Spanish?
I wouldn't know the answer to that question. It's probably the one and only that I don't know.
Oh, no. So what is that? What is irritable bowel syndrome? What is that?
Sure, yeah. So irritable bowel syndrome for many, many years has been looked at as a diagnosis of exclusion. So it's a pathophysiologic disorder. Some of the predominant symptoms are bloating, abdominal pain, nausea, diarrhea, constipation, all of the common sources of digestive distress. And what's exciting about this new test is that for the first time, Dr. Mark Pimentel and his colleagues at Cedars-Sinai Medical Center in Los Angeles have found an organic reason for why this disorder has come about. And the new test that we're currently offering is an antibody detection test to find that organic cause.
Oh, really? And when you find a cause, that usually means you find a cure. Am I right?
You are right, yeah. So what we're looking for is a bacterial buildup in the small bowel that, if the test comes back positive, we'll confidently be able to tell physicians and their patients that this is a true organic disorder and it's an antibiotic-responsive disease, as opposed to a disorder that has predominantly in the past been referred to as kind of an all-in-your-head type of symptom base. So
when you say antibiotic disease, I don't remember the second word you said there, but do we? What does that mean for us? Does that mean that our antibiotics are attacking things they shouldn't be attacking?
Yeah, so what this test does is it identifies a specific subset of irritable bowel syndrome patients with diarrhea that can now know confidently the reason why they have this disorder. So for many years it was a functional GI issue. There was nothing of organic cause that could be identified through a blood test. There was no biomarker to be able to tell you that your body was creating this autoimmune response to a toxin after a bout of acute gastroenteritis or food poisoning. And so what this does is it tells you that it's real. It validates the disorder for the patient who traditionally has gone 5, 6, 7 years until they actually get an empirical diagnosis of irritable bowel syndrome from their healthcare provider. This tells them confidently that you have irritable bowel syndrome, this is the reason why, and antibiotics will kill that bacteria and hopefully begin to increase the quality of life.
Oh, okay. And I'm guessing up until now people were probably very cautious about what they ate. Does that still apply? Do we have to be careful what we eat?
Yeah, well, look, I mean, I think you always want to be careful what you eat, especially when you're traveling and, eating in places that you may not be accustomed to how the food's prepared and things along those lines. And there's always opportunity for relapse as well. This is a disorder where, microbes in the small intestine can continue to find their way back, and you may need to go and get retreated. But what this test is finally doing is telling the providers and the patients the reason why it's there, why they're feeling the way they are, and what they can do to eradicate that.
Because irritable bowel syndrome is different from inflammatory bowel disease, so people have to be careful and cautious about what diagnosis they receive.
Absolutely, and that's what's so exciting about this data as well that Dr. Pimentel and his team at Cedars came to find is that it's a very nice differentiator between irritable bowel syndrome and inflammatory bowel disease, or IBD, as you had said, so ulcerative colitis and Crohn's disease and things along those lines. And the data was incredibly significant in terms of its breadth. So it was done across 180 centers, 2,500 plus subjects, which is astronomical in size when compared to a lot of other validation studies within diagnostics. So it's an exciting time for patients. There's 40 million irritable bowel syndrome patients in this country, and about 14 million of them aren't diagnosed. So it's an exciting time for patients who have suffered with this symptom set and have been frustrated and uncomfortable for far too many years. It's finally given them an answer, so it's exciting.
What is exactly in the blood that is, I guess, in the test, the blood test? How does a blood test give you information about the bowels? I just don't get this yet.
Sure, absolutely. So we're looking for two specific antibodies. The theory behind the pathogenesis of this specific subset of irritable bowel syndrome is that after a bout of acute gastroenteritis or common food poisoning, Campylobacter jejuni is a pathogen that then infects the bloodstream and releases a toxin called cytolethal distending toxin B. That then cross-reacts with the body's host protein that lives on the nerves of the gut called vinculin, creates an autoimmune response that then slows down the motility of the small intestine and creates a microbial or bacterial buildup in the small intestine that is then contributing to the patient's irritable bowel syndrome phenotype. On this specific test, we're looking for those two antibodies, cytolethal distending toxin B, as well as antivinculin, which is the body's reactive antibody.
Somebody who has already been diagnosed with irritable bowel syndrome, they've probably been living with it and been doing whatever their doctor has instructed them to do. Is this now information that we're talking about for our listeners to go back to their doctors and say, look, I heard something different on the radio. Can we try this and maybe alleviate some of the problems I've been having?
We ask that they please do. Absolutely. I mean, patients are their own best advocates, and I think that they're on the front lines in a lot of different scenarios, and anything that we can do to get the word out there about this new test and its clinical utility and the ability to come to a diagnosis a lot quicker than has traditionally been able to is a new development. It's a disruptive development in the disease state, and it's something that patients should be very excited about, and we hope that they do share with their healthcare provider.
Wow, wonderful stuff.
Very good stuff. I guess the last thing would be, how do we? Because if I were to try to explain this to my doctor, I would be, I don't know what they said, doctor. But can I give the doctor a website, or can I look at the website?
By all means, please do. So it's www.IBSChek. That's CHEK.com. And we can even take it a step further, actually, Larry. So on the website, there's an Ask Your Doctor guide. So the patient can go on, they can print out a specific set of questions that really will help the provider to understand the technology if they haven't already heard about it,
that's great.
As well as give them the opportunity to explain it to the patient in a way that is simplistic and straightforward.
Okay, IBSChek, CHEK, not CHECK, CHEK, IBSChek.com. Craig Strasnick, thank you so much. We have to run. We'll take a little break. This is WOCA Ocala.
The Source.
Fox News Radio, I'm Pat O'Neill. At least 180 now known dead from an earthquake centered in a remote area of northern Afghanistan.
The quake was felt in India, Pakistan, and Afghanistan.